Hello, good evening. This is Isha Thakur and I welcome you to LiveDate's YouTube channel for another live session. Today, we have the privilege to host Dr. K. Sampath Kumar, a renowned nephrologist with many credentials in his field of expertise. Dr. Sampath is presently working as the head of the department of nephrology at Meenakshi Mission Hospital, Madurai, with enormous previous experience in nephrology department. His research studies are primarily based on dialysis, kidney transplantation, gloro- glomerulonephritis, diabetes, and kidneys. He has pushed various research papers in national journals to his credit. With all of his experience and expertise, he is going to help us understand the myths and the facts of kidney transplantation and all the related queries among all of us. We welcome you, Dr. K. Sampath Kumar, and thank you for taking out time for the session today.
Thank you, Isha. So I'll share my screen and then give you an overview of the kidney transplantation and kidney diseases. Dear friends, let us do an analysis of certain myths and facts which are prevailing in renal transplant. See, what are the main functions of the kidneys? Kidneys are very important and vital organs which are tucked away behind the abdomen in each one of us, and they are a pair of bean-shaped organs. They perform the very important functions of maintenance of fluid and electrolyte balance in the body. They also regulate the blood pressure and they eliminate the waste products, most important of them being urea and creatinine. So the main causes of why kidneys fail in especially in Indian context is that diabetes is a very important cause and most common cause of chronic kidney disease, and it is followed by other diseases like hypertension, chronic glomerulonephritis, and others. So kidney transplantation, when both the kidneys fail, will be an ideal choice for management, because kidney transplantation provides unmatched improvement in the quality of life with better chances of survival, and overall the cost of transplantation is lower than long-term dialysis. In the current scenario, as far as India is concerned, we see this dubious problem of more than 150 to 230 patients per million population requiring a kidney transplant, and unfortunately only close to 7,000 transplants are performed annually. So you can see that there is a wide gap between the number of transplants which are required and which are performed in India. Part of the reason is that there has been a lot of prevailing myths about kidney donation and transplants. So let us see a few of these and then try to bust them. As far as the myths related to the kidney transplant recipients, the matching, eligibility, dialysis requirement, the survival of the graft, use of medications, etc. The myths related to the organ donation are due to matching procedures, use of medications, survival, and the day-to-day problems that these donors can face. So let us see what are the myths related to the kidney transplant recipients. So one of the important myths which we hear very often is that recipients do not have an option to receive a living donor kidney transplant if the blood groups do not match. So if the blood types do not match, it is commonly said that the donor cannot provide a kidney to the recipient. Now, with the great advances in the medical science, we have what is called ABO incompatible kidney transplants. So even if the blood groups do not match, kidney transplants could be successfully conducted, and many centers in India, including ours, are conducting kidney transplants across the blood group, even if there is a mismatch in the blood group, with the help of newer drugs and therapeutic advances. The second myth is that only younger people will be able to get a kidney transplant. We have now evidences that age is no bar for getting a kidney transplant. And in fact, people even above the age of 60, when they receive a kidney allograft, their overall kidney survival as well as the recipient survival are as good as younger individuals. The third myth is that you do a transplant and then that is the end of the story. The patients do not have to receive any drugs, which is wrong. Anti-rejection medications need to be conducted for as long as the patient has a working transplant. So even with the great advances in the field of kidney transplant, the kidney anti-rejection drugs have to be continued lifelong. The fourth myth is that a transplanted kidney will not last a lifetime. It is a fact that they do not last a very long time, but diseased kidneys last for as long as 15 years, while a living donor kidneys can last for between 15 to 20 years, which is very good. The other myth is that kidney transplant will affect future issues of pregnancy. After a kidney transplant, menstrual periods are likely to be, they can resume. The fact is, the menstrual periods can resume, and it is possible to mother a child. And most anti-rejection medications are safe, and you need to consult your nephrologist and also get his advice. And it is ideal that after a kidney transplant, a woman waits for a couple of years for the engraftment to be complete and safe, and so that she can mother a child. The myths related to kidney donors are that if a kidney donor is not a direct match, the transplant is not possible. So we have what is called a paired exchange program, where the kidney can be swapped, and a donor one will get a kidney to a recipient, and a donor two will give a kidney to another recipient. So it is possible to swap across the recipient pairs, and this is already possible in centers in India. Donating the kidney is a dangerous procedure. Of course, it's a major operation involving general anesthesia, and anywhere between 2 to 3 hours of surgery is required. But it is a safe procedure, and most donors spend between 3 to 4 days in the hospital, and they're able to return to work within a month. So The second myth is that donating a kidney reduces the donor's life expectancy. Donating a kidney does not reduce the live donor's life expectancy. Of course, these people have to be on regular medical follow-up for medical diseases like hypertension and diabetes and obesity. So it is a fact that these people have to be on lifelong medical follow-up on a regular basis. Living kidneys will not live a healthy life with just one kidney, which is a myth. The fact is, living kidney donors can live a healthy, normal life with one functioning kidney. Another important myth is that surgery will affect the donor's ability to have children. The fact is, there is no evidence to support that kidney donation impacts the ability to have children. It is a fact that donors who have who are mothering a child have to be on follow-up, and their incidence of hypertension during pregnancy is slightly higher. So it is important that they are on a close follow-up with a with a gynecologist during pregnancy. So you need to talk to your doctor to understand more about kidney transplant and to clarify your doubts regarding kidney transplant as a treatment option. So I would summarize and say that kidneys are very important and for life, and they do very important functions of homeostasis in the body, and kidneys can fail due to variety of causes, and when they fail permanently, the kidney transplant is the only option, and kidney transplant can provide a new hope of life for these patients with end-stage renal disease. And there are a lot of myths associated with kidney transplant. I have tried to bust a few myths and to make them understand the realities, which will help the patient consider kidney transplant as a viable kidney replacement option. And you need to discuss with the family members and loved ones before considering kidney transplant, and vitally, you need to discuss with the transplant team to clear your doubts and understand kidney transplant in a better way. Thank you very much.
Thank you so much, doctor, for giving us such great insights over this particular problem. So now we'll take few questions from our viewers, doctor.
Yeah.
So first, very basic question is that what is an early transplant or a preemptive transplant?
Yeah. See, patients who are already confirmed to have a disease, by which I mean their function is less than 10% of the kidney's normal function, and if the kidney specialist or the nephrologist has excluded all the other treatable options which are available, and he says that this kidney cannot come back to normal activity and you need to undergo a kidney transplant, there are options available which are called the preemptive transplant, by which I mean that you don't have to undergo dialysis, and these patients can directly be taken up for a kidney transplant program and undergo kidney transplant.
So another question, doctor, if a patient already has some health problems, existing health problems, so how safe it is for him or her to undergo kidney transplant?
Yeah, see, if the patient has health problems in the form of cardiac disease or uncontrolled diabetes or infections, all these have to be set right before a kidney transplant is undertaken. And this will be the job of the kidney transplant team. So they have to see that all the health issues are properly addressed and the patient is fit enough to undergo kidney transplant. There are multiple health issues, no doubt, which crop up during the workup of these patients, and each have to be very carefully dealt with. And it is possible that 90% of them are surmountable problems, and so they can be properly addressed, and we can subject them for a kidney transplant.
So, another question we have from our viewer, doctor, that is it actually all type of, if we talk about other type of kidney diseases, so is kidney transplant going to cure all type of kidney diseases?
Yeah, see, kidney transplant, once the patient has a very advanced kidney disease, kidney transplants are not advised when the kidneys fail by 50% or 70%. They are advised only when the kidney transplant, when the kidneys can no longer, the native kidneys the patient has can no longer sustain life. So that is a fairly advanced stage of kidney disease. And in those situations, we are able to do kidney transplant, and this provides another living kidney tissue, which is able to do 50% of the kidney's function, which is good enough.
So, another question we have from a viewer, doctor, that if a patient is already undergoing the dialysis process for a longer period of time, so is it safe for that patient to undergo kidney transplant?
Yes, the patients who are on dialysis are already enlisted on the kidney transplant programs across many states in India, and these patients will be waiting to receive a kidney. And these patients have to be carefully monitored during the dialysis sessions. They should not have active infection, and their blood pressure should be properly controlled, and their cardiac function should be properly monitored. So it is a fact that many of these kidney recipients who are waiting for a allograft have waited for many months, and a few of them have waited for even few years before they get a kidney transplant. So it is perfectly possible for these dialysis patients to wait for a kidney transplant and get it as and when allograft is available.
So, another question, doctor, if we talk about dialysis patients, so is it better to stick with dialysis to improve the patient's quality of life in place of having a kidney transplant surgery?
So we have to understand that dialysis can never be equal to kidney transplant. Dialysis does only 10% of the kidney's function, whereas allograft, which has been sutured onto the patient's blood vessels, is able to do 100% of the kidney's function. So a successful kidney transplant provides much better quality of life for the patient than dialysis.
So, doctor, is this true that female patients cannot get pregnant after kidney transplant surgery?
It is a myth, and it is untrue. So female patients who have undergone kidney transplant have successfully given birth to children, and they have to be on regular follow-up, and especially immediately after a successful kidney transplant, they shouldn't become pregnant, and they will have to wait for a period of say 1 year to even 1.5 years, and the kidney function should be adequate before they can be allowed for pregnancy.
So another question we have from our viewer doctor, that if a patient is already on dialysis, so is that dialysis process going to last for lifelong? So what will be the duration?
Yeah, these once they do not have a prospect of a kidney transplant, these patients have to be necessarily on dialysis lifelong, and this will be anywhere between uh, 2 to 3 times a week. Each time it is between 4 to 5 hours of dialysis. So this has got to carry on for the lifetime of the patient.
So, doctor, talking about the donor, if the donor already have certain medical condition, so will he or she be allowed to donate organs?
See, donors have to be very carefully chosen. The live donors have to be very carefully chosen, and we need to be very careful about the medical conditions. Supposing they have diabetes, they have hypertension, and they have morbid obesity, and if a kidney disease is running in the family, uh, they are all contraindications for donation. And so the nephrologist will be the best person to decide whether a given donor is ideally suited to donate the kidney.
So another question we have from our viewer doctor, that are there any kind of restrictions imposed on the donor's diet?
After the kidney donation, once the patient, once the donor gets discharged, absolutely there is no restrictions as far as the diet is concerned. With a view, only important caveat is that the excess eating and obesity should be curtailed at all costs. It is not only true for the donor, but it is also true for the general public as a whole. Yeah.
So, doctor, does the kidney donor need to be in the hospital for an extended period of time after his surgery?
No, the donors can leave the hospital, say within 4 to 5 days safely, and they don't have to have an extended period in
So,
hospital. Yeah.
Doctor, what are the major impacts that this surgery will have on a donor's life?
Uh, See, it is important that they should be made aware that they have got to be careful about the long term follow up. They need to come at least once a year for a complete medical checkup, and they should also have healthy lifestyle habits like taking vegetables and avoiding high salted food, and having regular exercises, and preventing high blood pressure, preventing diabetes. All these are very important as in a general population, and slightly more so for a donor. And this is what I want to convey. Yeah.
So, another question, doctor, that can living donors choose which person they want to donate their kidney to?
See, the the onus is on the donor. Sometimes when they pay, the donor can say that I would like to give my kidney to my own relative, like my own brother or sister, or to my own children. There is another type of kidney transplant which are being increasingly carried out in India and very successfully abroad, is that this is a non-directed kidney transplant where the donor is able to donate for a recipient who is not directly related or directly even known to the donor. But in turn, the recipient pair of the donor is able to donate his or her kidney to the patient who is known to the original donor. So this is called a swap transplant, which is being done under carefully regulated conditions in many of the transplant centers in the West and a few transplant centers in India, which is catching up.
So, another question we have from our viewer, doctor: does the lifespan of the living donor gets affected because of this transplant surgery?
No, the lifespan of the kidney donor does not get affected. The important caveat, which I repeatedly stress, is that these patients, these donors have to be on regular follow up. The multiple studies across the world have shown that their lifespan is not negatively impacted by a kidney donation.
So, doctor, talking about anti-rejection medications, is it required for a donor to take these anti-rejection medications after the kidney transplant surgery?
Yes, it is very important that they have to take these anti rejection medications lifelong. The major cause of kidney transplant failure after a few years of successful working of the kidney is that non-compliance. These patients become overconfident and they think that without the drug, the kidney can work, which is unfortunately not correct. These, the donated organ will have to be sustained with the help of drugs which have to be given for lifelong.
So, doctor, now moving on to the last question for our session today. Do donors have to be related to someone to give their kidney?
See, the Indian law states that kidney donation should not be performed for pecuniary reasons or for money. That apart, the kidney donation need not be performed only across relatives, and there are altruistic donors who are willing to donate for people for altruistic reasons. And I already told you about the non-directed kidney transplant or the swap kidney transplants, which can be performed for people who are not related to each other, which are perfectly legal. And these have to be certified by appointed renal transplant authorization committee, which are functioning across the states in India.
Thank you so much, Dr. Sampath, for providing us with such great insight over this particular problem. This marks the end of this session. To our viewers, we hope that we could cover all your concerns related to this topic. Librate and Good MD is here to convey true and authentic information to all your health related queries. For further updates, please stay connected with Librate Good MD. Thank you. Thank you so much, Dr. Sampath.
Thank you.